in December of 2020, and 2020 was about health. And 2020 accelerated digital transformation in many industries. Healthcare is one of them. So can you please talk to us about what did we see on this landscape in 2020 before we get into trends of the future?
Well, it's been certainly a very interesting and challenging year in all aspects. I mean, I could talk about the business side of things, society at large, and of course, as you mentioned, health has been kind of really transformed. We have the global pandemic. But before I kind of go to that, because we're talking about digital health and health in a context of industry, but also not just healthcare industry, but also society, I think what we've been seeing lately is, and I'm a great believer that what's happening later is it really highlighted what we should be doing in terms of digital transformation. For example, in digital health has been a big push in the last 4 or 5 years with regards to electronic medical records, to telemedicine, to emerging technologies addressing global issues. But now we really see that the systems, they were not actually prepared. Most of the governments, most of the organizations, they were not prepared for a big challenge, you know. So I think what happened, it really highlighted where the gaps are, the needs are, and what we could be doing and improve. And now we're seeing a big push about transformation going really fast, which is probably one of the benefits around the pandemic. Is not just negative connotation, is a benefit in terms of we all kind of have a wake-up call that we need to do things faster. So
absolutely. So we do realize that yes, 2020 was dramatic for everyone, and it's accelerated many industries. So in healthcare, we did start talking about telemedicine. We're talking about wearables in different way. We're talking about absolutely, different way as a consumer, but I'm sure providers, doctors who had to accelerate their digital move fast. So can you tell about this, all these different groups, how we all affected and what we will see in 2021?
Yeah, sure. I think the telemedicine and the video consultation, for example, virtual consultations have been moving really, really well. But now it became a point where, unfortunately, the last 6 months is probably the only option, because we can't go to hospitals, we can't go to the local doctor, we can't go and visit the clinician. So I think these technologies were already there, but I think going forward, nothing is limited to one direction, I believe, and I believe in doing things in many different ways. But what I've seen lately is that telemedicine is a reality to really go forward. In 2021, you will be probably the only way to kind of push healthcare forward in terms of visiting doctors and hospitals, because they're overwhelmed with COVID, they're overwhelmed with the long-term conditions of other patients. We don't want the average patient to kind of put more strain in the system. So if I have a normal condition, a cough or a flu, if I can visit a doctor online, is usually beneficial. I mean, from my doctor that can see me from the comfort of his home, I can have a doctor consultation from the comfort of my home, but also we're not putting strains in the system in terms of adding more risk and also adding more strain in terms of resources. So it's a really win-win for everybody.
Absolutely, and you're touching like good topic when consumers, us patient, us population, driving these new digital practices. So wearables, we do want to monitor much, right? We do want to know everything. Some people more comfortable, right, going in all the way, tracking every moment of their life and trying to understand every number they get back. So where is this cool innovation? So can we talk about big technology promise first?
Yeah, sure. I think the wearables have been, I see like we're in a different generation now, because I'm from the times where 20 years ago, 15 years ago, we had the pedometers. I don't know if you remember them. And it was only like a very
Yep.
a digital, you see the numbers of your steps, and it was like a big thing. I mean, I remember the corporate wellness days, the companies are buying pedometers for employees. Wearables have become a long way in terms of their development. And now I think it's becoming a bit less relevant, just the number of steps. They can do so much more, with sports performance, with sleep tracking, even monitoring and also managing of long-term conditions. And now wearables are actually permeating many industries. Of course, health and healthcare are the main industries because they give us from the human body, human insights, human data, health data in this case. But now they're permeating many industries from fintech to construction, so it's very interesting what's happening in the wearables world. We don't want to become too obsessed about what you mentioned about tracking every single move, because that can have a negative connotation. For example, for people trying to achieve weight loss, we all know that weight loss doesn't happen overnight. It's a consistent effort of eating healthier and exercise, more physical activity. If you have a wearable and expecting a miracle in a week, you might be very disappointed because it takes time to modify a behavior, and people sometimes might have a lot of expectation on wearable, and the wearable is not the miracle source. The miracle source is always the driver behind the wearable, which is the human being. But I strongly believe that technology, in combination with human being, we can really do wonders and make really great things happen.